What college did I attend? So for undergrad, when I was a biology major, that's where I went to Temple University. And then when I went back to school for my nursing degree, I went to the University of Penn. And currently, for my graduate degree, I'm at the University of Delaware. So I've been all over the place. And do I know stuff about babies? So when I was working at CHOP in the oncology unit, there were babies. I did have patients that were babies that had cancer. But now working in the ER, because I'm in an adult ER, I don't see babies that much. I have baby patients maybe like once a week, if that. It's not an everyday thing because there's a pediatric hospital nearby. So most parents take their sick babies to that hospital. But every now and then we do get pediatric patients. And I felt more comfortable caring for babies, I think, when I was working on the pediatric floor because it was something that I was doing more frequently. So now it's kind of working a different muscle when I do have a patient that's a baby. But yeah, with that, it's always what they say is when you have pediatric patients, you're not just caring for the patient, you're caring for everyone, right? Because a lot of times the patient can't talk or can't, express themselves adequately because it's just a child. So you're not only caring for that patient, you're also caring for the parent or the grandparent or whomever brought the patient in. So that's something to take into consideration if you decide to go into pediatrics. And that's a good thing. It helps you with your people skills. It helps you be more comfortable with children if you're a parent or looking to become a parent in the future. I think it helps with therapeutic communication, which is like the cornerstone of nursing, which is just communicating with people in a way that allows them to be open and honest. So because you don't want people to feel judged, you want them to be able to tell you whatever it is they want to tell you about what's going on with them, so you can best treat them, and that's always the end goal. So yeah, I think that's a good thing. Do you guys know any nurses, or what's inspired you to want to be interested in this field?
I actually know a lot of nurses. I got a lot of people that's nurses in my family. My grandmama nurse, my aunt a nurse. That's why
I'm sorry I wasn't in here for the beginning because I was trying to get the other presenters set up, but I had the pleasure of being here last time. You were here last year to share. I know a lot of people. What have you talked about so far? What did I miss? Real quick.
I talked about like my schooling journey, my college schooling journey, and where I'm working now, where I started. I tried to talk on the differences between the two areas, and I think I spoke on the importance of like shadowing a career field that you think you're interested in. If you can, I know the opportunity doesn't always present itself, but if it does, it's a good one to take up, just to see the pros and cons up close so you know what you're getting yourself into and see if it really is a good fit for you before fully committing, because college is expensive, it's an investment, it is time consuming. So you want to make sure that you're making the most informed choice for yourself that you can in the beginning. More expensive and more time consuming. I'm exhibit A of that.
But the good thing is that you do have the option of working. I mean, it doesn't make it easier. You still have to balance and juggle, but you have the option of starting a career in nursing at one level and then working while you pursue the career and pursue the degree. So even though it's an investment financially, you'll be working in order to earn money to help offset some of the costs of that career.
That's why I chose to do the degree I'm doing now, my doctorate, part-time. So it'll be a 5-year program by the time I finish, which is in May. And I did that not only so that I could continue to earn money, but I also wanted to continue to build my experience level as I was moving on to the next thing. I didn't want to enter nursing and work for a year and then get a graduate degree and then, tell people I'm an expert in things. I wanted to feel that I was fully immersing myself in the field and continuing to grow my knowledge base as I moved on to the next degree, so that when I got there, I would feel more secure in my practice and my knowledge. So that was my choice. Everyone doesn't do that. And also what your end goal is kind of can dictate what makes more sense. I do have friends who we were in nursing school together, and they went straight through from graduating nursing school straight into their master's program to work in primary care. And for them, that made more sense. So we just have to weigh your odds and see what makes sense, see what the job market is like, which is the thing you don't think about. They don't tell us to think about, but it's a thing. What the job market is like, because that affects how quickly you do or don't get a job, and
Right.
what you can or can't make, where you can or can't work. So there are things to keep in mind as well.
So from a starting point for a student who's in high school, some of our students are just starting high school. So for a starting point, let's just say they are in the position where the thought of a lot of school might be a little intimidating right now, in terms of, I'm in school right now, and the thought of so many more years of school might be intimidating. What would you say to that student who really wants to get started in nursing, and they can't at high school, of course, but once they graduate, what's a good path for people to take?
So that's your feeling, I would say. So there are tons of people who piecemeal, like I like to call it, piecemeal their education, which is totally okay. Which means they may have started, they could have now been in their field for 40 years, and they started as a CNA, which you talked about, for maybe 5 years, and then they decided, oh, let me go get my associate's degree to be a nurse. Did that while they continued to work, and they were associate's degree nurse for a couple of years, and they got their bachelor's, and so you can build on it. It's not something you have to do all in one time. You don't have to do it the same speed as me. You don't have to do it faster or slower. You do it however you feel makes the most sense for your life. And nursing is very flexible that way, and that you can work at every level. And then also there's tons of things you can do as a nurse. You don't have to be bedside. And I think that really was evident with the whole pandemic. A lot of nurses, especially the older nurses who were closer to retirement anyway, left the bedside because it was stressful. It was a very hard time, the hardest time in my nursing career so far. And it was very stressful, and it was scary. And some of people who maybe were having babies and didn't know what that meant for their child, they didn't want to be at the bedside anymore. There are ways to maneuver out of that. You can work in legal. You can be a consultant for a lawyer who's working on medical cases. You can do that, which doesn't require you really to deal with patients. You can do education. You can teach at if you want to teach at a CNA program or a nursing program, I think you need at least your bachelor's. If you want to teach on a college level, you do need at least your master's for that. But that's an option as well, to go into education. You can also go into training. You can also go into the board. There's a board for each state, of nursing board in each state, that kind of dictates what nurses can do in that state and what their licensures should be and how often they should renew, et cetera, et cetera. You can work on a board like that. I'm just naming things that are coming to mind, but there's tons of things that you can do that don't require you to be at the bedside. That's not what you ultimately want. So it's a very flexible career. You can pick your own, to an extent. You can pick your own schedule. For example, right now, to accommodate for me doing clinicals and being in the clinical portion of my program right now, I leave the front half of my week open for that. And I typically work Wednesday night, Thursday night, Friday night. Usually have a weekend requirement. Mine is every 4 weeks, which is once a month. So on that week, I would do Thursday night, Friday night, Saturday night. And I do 7 p.m. to 7 a.m. You don't have to do that. Some people hate night shift. I get it. It's hard. It is not normal. You're opposite from literally everyone else you know. You have to have energy at times when no one else does, and vice versa. So it's difficult to get used to. And it's difficult to sustain for a long time. And I've been doing night shift since I became a nurse, so 6 years. But you don't have to do that. You can do day shift, and then it depends on the floor you're on as well. In the ER, we have tons of shifts. You can do 3 to 3, 11 to 11, 7 to 7. So it varies. But that's, again, speaks to the flexibility of it. Me being able to move my days around to allow me to do clinical in the beginning of the week. That allows me to still work full time and do the full load of my program at the same time.
Okay. So you were able to that was up to you. You were able to work with whoever to make a choice on what times worked for you, what days worked for you, and So you have that flexibility. I do notice that you have a life outside of nursing. So I do admire that, because to me, from the outside looking in, it just seemed like a career that it would be difficult to balance, like that work-life balance, because it just seemed like the people that I knew would do double shifts and triple shifts, and it would just seem like they wouldn't have time to do a lot of things. But it's good to hear you say that it's not always the case, depending on what's going on at the time. Like, I'm sure during the pandemic, it was times when you had to work shifts that you normally didn't work. But once that settled down, you were able to go back to the flexible schedule where you would work the days that worked around your schooling. So that's good to know, or around your family, because we do have some parents, some teen parents here who have children and thinking about nursing. You know, how do I work that around my children? So it's good to know that you can do a night shift. Maybe if you have someone to care for your kids at night, so you can be with them during the day. You can choose different days. So maybe you can have some weekends where you can be with your family, and then other weekends, like you said, your schedule is every 4 weeks. So, you know, going in, you can make plans and be with your family during that time. So that's good to know that there's that flexibility.
Yeah, and there are tons of, most of my coworkers actually are parents, and I think it really does. It's based on what that family flow is, if that makes sense. Like, for example, one of the nurses I work with, her husband, I think, is a medic or EMT, and they work like 24-hour on-call shifts. So for her, it makes more sense to work 3 a.m. to 3 p.m. That sounds crazy to a lot of people, but that covers like the open period of when her husband is home, and it works for them.
Right.
So you can totally like customize it to you. You can work 8-hour shifts instead of 12. If you feel like, you know, you're having a hard time getting childcare, you can work 11 p.m. to 7 a.m., be home to take your kids to school and then sleep. So people you can make it work for you. You can negotiate for any job. Like, people don't tell you that either.
Right,
You have the power to negotiate. That's something that I did when I went into, I started in the ER. I started off in Newark. I'm now in Wilmington. And when I transferred to Wilmington, that was something I said coming in, like, I don't want to work Sundays, but I will work every Friday night for you. And that worked for me because, again, it allowed me to have my week open in the beginning to do school. But it worked for them because Fridays are really busy. You need Friday. So you have to find ways to ask for things that work for you, that also benefit the company. And, you know, it's constant reevaluation.
And that is so excellent you said that, because we've been talking to our teens about advocating for themselves, speaking up for themselves, asking questions, negotiations. So I'm so glad you said that, because sometimes people see maybe what someone else's life is like as a nurse, and they think, oh, that's how it is, because that person is choosing what works for them, or they may not be advocating for something more flexible. Whereas if you go in knowing that you are of value to that company, you go in saying, you know, I can do this, I can't do this, and then letting them decide, and like you say, negotiating, compromising maybe, but being able to get some of the things that you need for you and for your family, for your lifestyle. So I'm so glad you touched on that, because we've been talking about that for the past 3 weeks.
And also what you just said, like, you knowing that you're of value, in order to have that kind of footing going into negotiation, you have to make yourself of value. So you need to be on time to work. You need to be doing what you need to do, what you're expected to do. If there's a team that you want to join, like, they have different teams in a lot of facilities, like governance and stuff like that, just to make sure things are flowing smooth. You don't have to, but you can join a team to show that you have leadership. You can get a new certification. Like, you have to do things to make yourself valuable so that you can garner those type of things. And so that, you know, they want you there, and you're important to the floor, as well as them being important in your career too. Nice.
What made you decide to pursue a nurse practitioner? I didn't hear that part. If you said it already, I'm sorry.
I don't think I went into in deep detail. So I was initially pre-med, and then I started shadowing a doctor, I think it was the summer between junior and senior year of college. And it was my doctor, actually. It wasn't him, but it was his office. And I was shadowing them, and everything seemed fine, but it happened to be an office full of women at the time, and they were all kind of either pregnant or just had kids, and kind of seeming a little bit upset that they weren't around their kids as much as they wanted to be. And then one of the days, the nurse practitioner happened to have been there. The doctor I was following was out, so I shadowed her. That was my first time meeting a nurse practitioner. And I realized that her role was very similar, but she didn't have a lot of the other things that were dictating her time outside of the practice. And it seemed like her work-life balance was a little bit more along the lines of what I wanted. It also seemed like her bedside manner aligned a little bit better with my personality. And that's just the difference between medical doctor and being a nurse practitioner. Is just the way you're trained to think about issues and the way you're trained to go about treating people. One's not wrong or right, it's just different. And I felt that the way that she was going about was a little bit, it seemed better to me, and it made more sense to me in the way that I wanted to treat patients. So that's why I started going down that route. And then once I started looking into it and realizing how flexible it was and how many things I could do, and I didn't always have to be one thing. I didn't always have to be at the bedside, or I didn't always have to be in the office practicing, that I could do almost whatever I wanted with it. That seemed appealing to me. That's why I decided to go that way.
Okay. Did you share with them about your experience as an EMT?
Oh my goodness, I forgot. So I just talking about CNA, which is, so the EMT, I did that in.
And tell them what an EMT is in case they don't know. Most probably do, but just let them know.
Medical technician. So it's kind of the role that's right under what a paramedic would be. You can't give meds as an EMT, which a paramedic can do for a patient, but you would get the vital signs, you help to stabilize, and you attend all the calls and things like that.
And you're in the ambulance?
In the ambulance, most of them are affiliated with a fire department. Almost all of them are affiliated with a fire department. And they have most of them have a volunteer option, or you could be employed. So when I did it as a volunteer option, and I was working for Springfield, PA, which is Delaware County. But I did my program at Temple, but it wasn't through Temple. It was I'm trying to think of the name of the program.
Like an offset.
In case of emergency.
Okay.
I think it's called ICE. And they held their sessions on campus. And I did that right after right after I decided to go into nursing school after I graduated, and I still had 1.5 years left of my bio degree. And I just wanted patient experience. Okay. And that was my way.
You don't have to have a degree to be an EMT, right? You can do that even right out of high school.
It's a 3-month program, 3 or 4 month program. And after you finish, you have to get a certain number of hours in the program. After you finish the program, again, it's another state test. It's a little bit different though. There's a written portion, and then there's also kind of like a mock patient situation. So like they'll have you come in and there's a fake patient and they give you the scenario, what happened, and there's certain things they expect you to go through and do and verbalize, and then based on that and then the score of your written test, you either pass or fail.
You volunteered, you said, but you can get paid.
You can get paid.
So you can take like 3 or 4 months of the training, whatever the training is, then you would actually work as an EMT, and that's another pathway into the medical field, into the health field. Yep. You can stay at EMT. I know people, I know one young man who was here last year, he started as an EMT, and then that made him more motivated to become a nurse. And he became a nurse at Jefferson Hospital. And now he's like, I don't know, some kind of nurse. He's like some big nurse manager or something. I don't even know what he is now, but.
You can do, that's outside of the bedside. You can be a manager. You can be in research. Okay. You like being in the lab. Those are all things. Sorry, that was a sidebar. But yes, you can. EMT is a pathway into medicine as well. And for me, I was really nervous just about patient interactions and just talking to a patient. And that was something that I was really hung up on. So becoming an EMT allowed me to get that out of the way and get good at it and get used to it and be okay with talking to people and making them feel comfortable and getting the answers that I needed so that I could treat them appropriately. So when I went into nursing, that definitely gave me a little bit of a leg up in nursing school, because I knew that part already and it wasn't new knowledge. So it was easier for me to get into my clinicals and to feel comfortable with what I was doing because I was used to talking to people in that kind of venue. So yeah, CNA, EMT. From an EMT, you can go anywhere. You can go into nursing. You can go into being a doctor. You can go into being a PA. You can go up the chain to be a paramedic. And they also ride on the ambulance with the EMTs. But again, they can give medications. They learn how to intubate, which is when you put the tube in a patient so that they're unable to breathe for themselves. A medic is usually the person who does that if it's done in the field and not at the hospital. Yeah, and also being an EMT, when you drop a patient off at the hospital, you have to give report to the nurses there. And report is a big part of nursing, patient handoff, and making sure you're relaying the right information to the next person to care for that patient. They gave me a lot of practice with doing report as well, dropping patients off at the hospital. So yeah, there's a lot of benefit to that, for sure.
So you were like on one side, and then when you became a nurse, you got on the other side of that, but you understood. So it gave you kind of an advantage over people who had never been an EMT.
And then it helped my emergency nursing as well, because I saw, I mean, it was Springfield, so it wasn't a whole lot going on, to be honest, like not in comparison to like Philly or another bigger city. But I had seen something. So when I got into the ER, everything wasn't a big shock to me. It was like, oh, I can handle this.
Okay.
Because I had already seen some crazy things in the ambulance. So
gotcha. I always wondered about that because I knew you were an emergency room nurse, and I always thought about like the TV shows and how like crazy it just seems being in the emergency room. And that makes sense that having been an EMT prepared you for kind of the pace and, you know, just how kind of quickly things can spin into like a very emergency situation, how you have to keep your calm. What do you think is your greatest quality or skill that helps you the most as a nurse?
I think that changes over time, what you consider your greatest skill to be. It should change over time. But where I'm at right now, I think that I don't fold under pressure. I work well under pressure, which after working in the ER for a while, you better work well under pressure. So I feel like that has helped me with work, especially with the pandemic and all of the crazy things that I saw during the pandemic and the tragic things, and being able to work well under pressure and to work with a team well, because a lot of nursing is teamwork, especially when you're talking about emergency and death situations. It's a team that has to care for the patient and care for the family. So I think it helped me a lot to get through the pandemic and to not be totally emotionally distraught by it, because a lot of people were, unfortunately. And it also helps with school. When I have so much going on, when I have such a crazy schedule and I'm in clinical one day and class one day, and now I'm at work the rest of the week, it helps to be able to compartmentalize and let me handle this task, relax. So yeah, I think that's my best quality right now.
Thank you. I just want to thank you, Shavon. It's been, again, so much information. A lot of people want to know about nursing, but it's so much that they don't know, I think, and it's always good to have someone come and talk about it.